Hi, everyone. Our topic today is on military families, and my name is Alicia Anderson. Some of the learning objectives are: where do military families come from? What are the benefits of health and illness in military families? What are some health concerns military families face? What health practices do military families believe in? And how to be culturally competent when dealing with military families.
So first off, in military families, in the background, there are two types of them. There is the veteran family, which is immediately family members related by blood, marriage, or adoption to a veteran in the U.S. Armed Forces, including one who is deceased. Therefore, that's someone who's not currently active in the military. And then secondly, there's a military family, which is immediately family members related by blood, marriage, or adoption to a current member of the U.S. Armed Forces, including one who is deceased. So that is then basically saying that they're still pretty much the same thing, except for one of them is active and one of them isn't. Common characteristics for military families are military families are relocated roughly 10 times or more often than that compared to civilian families, on average every 2 to 3 years. This will also lead to student or children becoming unattached to friends because they might leave quickly, as well as service members are more likely to be married at a younger age, which also means that they'll probably end up having children at a younger age. And then sometimes from that, they get judged by other people, and it leads to a higher risk of divorce and higher rates of suicide as well in the military. Going off of that as well, deployment has been associated with poor mental health in military families, as well as behavioral problems in children, which I already talked about a tiny bit. And then next up, common characteristics in military families is state and federal benefits for them. They get quite a few benefits for food, tax payoffs, and also for medical aid. And then another very important thing is discipline within the family.
All right, health and illness for military families. Military families believe in good health is significant for family readiness, with service members being able to perform their obligations at work and at home to the best of their abilities. There's usually one person in the family that's either being deployed or is coming back home, and when they're beyond on deployed, they rely on their family and the brothers in the military to support. And then when they come home, they're asking for support of the family, especially when they come home injured, because service members have to go through PT, hospital bills, everything they have to do is relies on their support. Especially, and then when they're transitioning back from service to civilian life, it's one of the hardest times for them. So military people usually only talk to the other people who have gone through it because they have a tough time explaining what they went through to their own family. So when they're defining health and illness for military families is for service members' ability to perform their responsibilities. So is this like with to get up in the morning? Are they able to go to work? Are they stay physically fit for when they're out being deployed? Are they able to mentally get through the day? So for the family is when not being able to follow day-to-day responsibilities. So for the rest of the family, so like the child is not able to go to school or something's causing them to not be able to do what they usually do during the day, or like the mom is not able to take care of the family for some reason. That could be health or illness for military families.
Health practices and resources in military families is very diverse. So military families, to start, they have a variety of resources that they are able to use and have access from military organizations, as well as third-party nonprofit organizations that are really going to help them to overcome their illnesses. So some specific resources that are given to military families are, military insurance or TRICARE, VA clinics that are able to really help the veterans. Those are really veteran specific, and hospitals and clinics that are run specifically by the United States military. And then these are all going to help just get access to the kind of standard American healthcare system and really be able to have full access to it. So these military hospitals, they're all over the world. There's some in Germany, but some prominent ones are in San Diego and Bethesda, Maryland, and there's a couple in Texas as well. And these military hospitals, they're just here to give help to the families and to the public, but they are ran entirely by the military. The doctors, the nurses, the people who work there, they're employed by the military. They are service members. And so it's really a military organization. It's part of it. An interesting aspect of these military hospitals also is that it enables families who are overseas with their service member. Like I had a friend who their entire family moved to Germany, and they were all there together. And what happens is in a setting like that, if they needed to come back to the United States for healthcare, they're able to have access to the military, the whole military organization, health organization, to get them to where they need to be for the best optimal care for their family member or for their service member. I've heard a couple of stories where, they're kind of remote. They're in, a small part of Italy or someplace like that, and they have to get flown, to a large American hospital that's in Germany or back here in the United States. There's also a bunch of organizations that are working with families who are at home, such as the AACAP, which is the American Academy of Child and Adolescent Psychology. It's really going to help address the stress and the depression that comes from a family member leaving or, coming back injured, and really helping them to address that specific stress. Another program that really helps families at home, WWP, the Wounded Warrior Program, really helps to provide equipment and supplies and counseling for military families who have, family members who are not wounded or are, otherwise disabled. And really that helps them, if the spouse needs to find a job, they will be able to help there. They'll be able to really provide counseling again and try to help these families come back to a regular life as close as they can get back to how their life was. And that's very important for them and for the overall health of the family. There's a couple other branch specific programs that are ran. There's the Army Family Readiness Program, the Air Force Family Readiness Program. I believe the Navy and the Marine Corps have one as well. But a large reason why military families are so diverse is just because they come from all walks of life. And when they do, they bring their cultural practices from wherever they came from. Whether they're Hispanic or African American or Asian or Caucasian, they all bring their health practices with them, whether, they use shrines and prayer to help with their mental and physical health, or whether they use common medical practices that they have access to at hospitals and clinics, or whether it's lesser known or less mainstream health practices such as acupuncture or a chiropractor, or maybe even just a home remedy that they've grown up with that they're going to use, and it's able to help them. Many service members have a hard time seeking mental help or help with mental illness, and they rely a lot on their own home remedies, their own coping mechanisms. But a large part of why they're not going to reach out for help is the stigma of looking weak, or that the healthcare system really isn't going to help them. And so that's kind of difficult because sometimes their own coping mechanisms are just not enough, or they just need a little bit of added support. But those who do seek help, they're often going to see the use of a lot of counseling just to kind of help them to retrain how they're thinking about certain things, and acupuncture is on the rise as a treatment for them. They also use a lot of physical therapy for physical illness, really trying to just nurse injuries along and physical illness to really get them to feel better, to get them moving and exercise that part. We're also going to use pharmaceuticals, whether that's antibiotics or painkillers, to really overcome illness. And when an injury is really severe, they're going to have to use surgery, and surgery is a common treatment used by military families. And that kind of wraps up their health practices and resources. Again, it's going to be very diverse. Whatever culture they grew up in or they embody, that's going to be their main source of health practice. These are just some kind of programs that are available to the families and what they provide. But again, the military is a very diverse place, and it's going to have very diverse practices, and they share that with each other. If somebody is using, let's say Tiger Balm to overcome an injury, and they're going to tell their friends about it, their friends might try it, the families are going to try it, and it's just going to be a very diverse place with lots of mixing of cultural treatments anyways. And that kind of wraps up health practices and resources.
Health concerns and circumstances for military families. Soldiers and their families make many sacrifices, including their health. As of 2014, 50% of military children are treated for mental illness due to prolonged separation from a parent, deployment, and frequent relocation. The most common health concerns that affect the soldiers are post-traumatic stress disorder, depression, and traumatic brain injury. After September 11th, more than 2.1 million service members have been deployed to Iraq and Afghanistan. From the year 2000 to 2015, over 300,000 military veterans that have returned from Iraq and Afghanistan have been diagnosed with PTSD. 2 out of 3 of those with PTSD also suffer from depression. 1 out of 3 of those with a TBI also suffer PTSD. Each day, 20 military veterans commit suicide. As of 2019, over 15,000 active duty soldiers were diagnosed with a TBI. Between the years 2007 and 2014, the number of soldiers diagnosed with a TBI ranged from 23,000 to 32,000. It is not until recent years that the numbers have dropped to around 17 or 18,000, which is still a lot.
My name is Alyssa Sanders. I created the slide concerning behaviors and beliefs of military families. For my information, I interviewed my uncle who has been in the Air Force for 35 years and a website concerning military beliefs and structures. My uncle explained that his home and thousands of others structure it around trust, respect, and dependability, which were among the most important values to their household. This is because throughout their time in the military, they're expected to be structural, prompt, honest, and trustworthy, and that mirrors in their homes. Something I found very interesting was that he told me that religion doesn't play as large of a role in most military households as I had previously thought. There is a long-standing stereotype with military members that they are true Americans, and with that comes a strong Christian belief, which is in fact untrue. To conclude, like mentioned in previous slides, strength in every aspect is extremely important to individuals in the military. Parents and their children are expected to be in good mental, physical, and spiritual health to prepare them for any situations that they could face.
Next up is sociocultural factors. Sociocultural factors, or sociocultural, is a term related to social and cultural factors, which means common traditions, habits, patterns, and beliefs present in a population group. So for example, the military culture is considered to be a dysfunctional family at times, but one that drives service members to complete a task for a common mission. Often hard for parents and children of members in the military, outcasted due to usually being younger when kids are born with other parents not around due to being active in the military, and then usually a very rigid structured family or sense of order and unity whenever the 2 parents are home, but whenever it's just one parent, it's usually not as structured as people would hope it would be. So going off of that, basically the military culture is there to, or it's pretty much, like it said, dysfunctional family at times, but so are most families. Basically, it's more about trying to stay for a common goal and trying to make sure that everyone is able to follow what the government even says about family culture, which is loyalty, bear the truth, faith to allegiance to the U.S. Constitution, the Army, your unit, and other soldiers, duty, respect, selfless service, honor, integrity, and personal courage. So it's a very military point of view, and it's talking about honoring the nation a lot, and it shows how these families usually become very service respected, and they want to help out with other people in the future in their communities. So usually they help out a lot, but they get ridiculed sometimes by the different people who aren't part of military culture.
This is our hypothetical character. Justin is a member of the U.S. Armed Forces. He is a Caucasian single soldier fresh out of basic training, with no religious background. He is a fit 22-year-old that loves to go to the gym and participate in sports while he's not at work. For some reason, Justin has come into our facility today. At acute care, Justin has come in today with a swollen hand and thumb after playing basketball in the local gym. Justin prefers more of a biomedicinal form of treatment, which requires some x-rays, a brace if needed, and also some prescribed medication for possible pain relief. The doctor also suggests doing some warm cold compresses as a form of traditional care used by many to help decrease swelling and bruising. He came into psychiatric care today. Justin has come into the office today because he has been showing signs and symptoms of anxiety. The doctor takes blood samples and has Justin fill out surveys to help in determining the best course of action. Based on the results from both tests, Justin is eligible for medication, but he is reluctant to try. The doctor also offers other options like going to see a therapist instead, or going to practices like yoga and learning meditation as a form of alternative medicine in treating his illness.
There are many different aspects when it comes to cultural competency for military families. One aspect that can be improved when dealing with military families is considering the culture of them. By doing this, it allows the healthcare provider to put the patient's symptoms into context and therefore improve health outcomes. Another way providers can become more culturally competent with this subculture is by having sensitivity towards the values and beliefs by those who have served their country. This will help them understand that the priority of the healthcare professional is to understand them and help them in any way they can. Lastly, it is important for doctors and other providers to be able to identify and assess health concerns related to military service. Believe it or not, doctors may or may not be asking patients if they have or are serving in the military. This can change everything because if they have served, then they could be more susceptible to certain diseases, or they could have traumatic brain injury, depression, or post-traumatic stress disorder that has gone undiagnosed. One of the easiest ways to improve this is to ensure that providers are asking those questions about whether or not they have served, and if they have served, asking more specifically where and when they did serve. The best and most efficient way to ensure culturally competent care for military families is to increase training for healthcare professionals on post-traumatic stress disorder, traumatic brain injuries, and depression for those who have served. Another way to do this is to include more about military families in things like licensing exams, textbooks, etc. This can help healthcare providers better understand the subculture and what they go through.
Let's relate our hypothetical character Justin to these situations. As an example of considering the family's culture, when he goes to get treated, it's important that his doctors understand what he is going through both mentally and physically in order to improve his diagnosis. It is also important that they know what Justin needs to do on a daily basis so they can make sure he can still do those things after being treated. For showing sensitivity, the doctors should show him respect by thanking him for his service and respecting his values. This helps make sure Justin knows the doctors are there for his well-being and actually care about him. For identifying health concerns with military service, it's important that they know that Justin just went through basic training. Knowing simple information like this will help make sure a diagnosis help make a diagnosis and figure out why he has anxiety.
On military families. The first one is, what are some other ways healthcare providers can improve cultural competency with military families? I just included some things that we mentioned in the slide. So, handling the patient's symptoms in context by asking specific questions, or just becoming educated on what military soldiers are more susceptible to, such as PTSD, TBI, and depression, anxiety, just to ensure a proper diagnosis. And the second question is, should doctors go through additional training to improve their cultural understanding when dealing with military families? This one varies from person to person, so it just depends on how you feel, if you think that medical schools should educate doctors more, or if someone should go through a certification program. Maybe if you're serving in a veterans hospital, maybe then you should go through additional training in order to become more culturally competent with the subculture that you're dealing with.